To understand the history of the Department of Surgery, one has to go back in time even before the Cebu Institute of Medicine was founded, to a time in the pre-war era where Cebu was the center of commerce and progress, with a robust and promising economy and stable political landscape, to an era where the practice of medicine was that most physicians, after their graduation, would immerse themselves in the practice of both medicine and surgery. At the turn of the 19th century, Jacinto was born on December 6, 1902, to Teodoro Velez and Hermenegilda Veloso. The young Jacinto Velez would then enter the University of Santo Tomas College of Medicine to study medicine and graduate in 1926 at the age of 23 years old. He then pursued his career as a physician with Southern Islands Hospital. After 11 years of hospital medical practice, Dr. Jacinto Velez dedicated himself to private practice. He opened the Velez Medical Clinic with a second-hand X-ray unit and a few beds to start with. Within a few months, his clinic became immensely popular until World War II broke out. At the outbreak of the Second World War in 1941, Dr. Jacinto Velez stayed in the city to continue his clinic practice, but supported the guerrillas, secretly visiting them to attend to their needs. After the war, when times came to normalcy, Dr. Jacinto Velez resumed his practice in the city of Cebu. Dr. Jacinto Velez juggled as a surgeon, radiologist, and even as an embalmer at the Southern Islands Hospital. In 1947, he decided to rebuild his clinic. He re-established his clinic, this time with an even bigger X-ray unit than he used to have in the pre-war. Using GI sheets, scrap iron, fluorescent bulbs, surplus from the war, Dr. Velez built the hospital. The patients then were those of the companies where Dr. Velez served as a retainer. Because of the increasing number of patients, the building had to be expanded and the bed capacity rose to 100. In the late 1940s and early 1950s, there was a steady influx of foreign-trained doctors in all specialties, including surgeons. These breed of physicians who were graduates of either UP or UST, the only medical schools at that time, brought in the beginning of specialization. Among these bright and promising batch was Dr. Renato Espinosa, who with Dr. Venustiano Borromeo pioneered urologic surgery at Velez Clinic, Dr. Gaudencio Hermosissima, Drs. Merito and Suga Yuvienco, and Dr. Esteban Lacson. In 1952, Dr. Velez founded the College of Nursing. It was during the years that followed that Dr. Velez, together with Dr. Espinosa, Dr. Ulderico Bacay, and Dr. Benito Antigua, planned for the College of Medicine. The College of Medicine opened in 1957 as the Cebu Institute of Technology College of Medicine, with Dr. Jacinto Velez as the first dean. Dr. Ulderico Bacay, a general surgeon, was the assistant dean, and Dr. Renato Espinosa A urologist was the college secretary. During the early years of the College of Medicine, the Department of Surgery was not yet formalized as a separate department. Faculty members were not separated into medicine, surgery, or any other department. Among the faculty was Dr. Vicente Perez, who first served as resident physician and was later tapped to teach neuroanatomy with the school for about 2 years before he left for the States to train in surgery. Other prominent names in surgery include Dr. Samuel Tosho, General Surgeon, and Gaudencio Hermosissima, General Surgeon, who taught physiology, Dr. Merito Yuvienco, Orthopedics, and Dr. Ramon Arsenas, OBGYN, who taught anatomy. Dr. Benigno Aldana Jr., neurosurgeon who taught neurology. By 1963, with the school well on its 6th year, more and more specialist surgeons and academicians arrived from the U.S. And by school year 1964, the section of surgery was now made into a separate department of surgery. With Dr. Ulterico Bacay as the first chairman. The Philippine College of Surgeons Cebu chapter was organized in 1948, causing an increased interest in surgical education and residency training. Thus, in 1968, the Department of Surgery of the Cebu Institute of Medicine, Cebu Village General Hospital, formed a structured, non-accredited surgical residency training program, with Dr. Renato Espinosa, who assumed chairmanship from Dr. Bacay as the department chairman. When Dr. Cesar Chan, CIM Class 1963, returned from his training in the US, he spent time to help set up the residency training program for general surgery. Its first residents were Dr. Liberty Tablante and Dr. Luis Faelnar. By 1974, Dr. Espinosa went on official leave with Dr. Jesus Enad as the acting chairman until 1977, when he was installed as the department chairman. Since the founding of the Cebu Institute of Medicine, there has always been one department chairman, both for the school and hospital. However, in December of 1977, certain events took over that caused a slight shift in this setup. During this time, the residency training program for surgery at CVGH applied for accreditation with the Philippine College of Surgeons. As per PCS records, the CVGH training program was given partial accreditation of 3 years in December 1977. Inasmuch as PCS required a PCS fellow for the chairman of the program, Dr. Vicente Perez, a PCS fellow, was tapped to chair the residency training program. At CVGH, Dr. Perez introduced a structured residency training wherein residents would retain anesthesia, surgical specialties, and general surgery. Among the residents at that time was the son of the founder of the school, Dr. Jacinto Velez Jr., who was a first-year resident, along with Dr. Francisco Tan Jr. and Dr. Nestor Siniza in 1978. In 1979, some of the faculty teaching the department at CIM included Dr. Bakli, Dr. Juveno Mata, Dr. Manuel Juanillo, and Dr. Bonifacio Cabarro. It was also during this year that Dr. Jesus Enad relinquished the mantle of chairmanship to Dr. Merito Yuvienco. In 1984, the last year of Dr. Perez's term as chairman, the residency training program graduated Dr. Rene Rafos and Dr. Ernesto Estorba, both of CIM Class 79. Both Dr. Rafos and Dr. Estorba would later pass the board certification examinations given to the Philippine Board of Surgery and become the first graduates of the program to do so. By June 1985, Dr. Reynaldo Baclig took over the chairmanship of the department from both Dr. Yuvienco and Dr. Vicente Perez, ending the schism of the chairmanship. The 80s witnessed more and more dedicated faculty surgeons gradually coming home, trained from Manila-based training programs from various surgical specialties. Among the first few batches in 1984 was Dr. Marianito Ante, who came from UERMMC. In 1985, together with Dr. Baclig, he would help implement the first surgical curriculum as prescribed by PCS, which was adapted not only for residents but for the school as well. Dr. Amado Lino, CIM Class 77. A year later, Dr. Wyben Briones, CIM Class 78, arrived from neurosurgery training at UPPGH. Together with Dr. Lino, they would set up the neuroscience ward in 1986, wherein CIM through CVGH became a neuroscience institution catering to indigent patients with neurosurgical problems in Cebu and the Visayas. The late 1980s saw more faculty surgeons arriving from different training programs here and abroad. Among them were Drs. Kenneth Chan, CIM 81, UPPGH, Stephen Siguan, UERMMC, Class 80, UPPGH, both general surgeons, Rene Rafos, CIM Class 79, Pediatric Surgery. Together with Dr. Ante, they would form the core of the GS residency training staff. Upon the recommendation by the PCS, a consortium with the training program of the Perpetual Succor Hospital was made. The consortium would go on to exist for 19 strong years. In In 2006, Dr. Reynaldo Baclig turned over the chairmanship as department chair to Dr. Rene Rafols, who chaired for 4 years until May 2010. By the opening of the school year of 2010, Dr. Kenneth S. Chan assumed from Dr. Rafols as the new chairman. Dr. Chan became the 7th department chairman in succession until May 2014. This year, the Jubilee year, ushers in the new chair of the department, Dr. Stephen Siguan, with hopeful plans and optimism to achieve new heights in academic excellence and service.
The day we met, frozen, I held my breath. Right from the start, I knew that I'd found the home for my heart. Beats fast, colors and promises.